Hello guys, this is Dr. Chatterjee, and in our previous video we were discussing about PCOD, that is polycystic ovarian disease, and how we can treat it with homeopathy. Similarly, this week I wanted to discuss with you guys about uterine fibroid. Uterine fibroid is a non-cancerous growth of the uterus that is benign in nature, and it is the most commonest type of fibroid, means commonest type of benign tumor in a female body during their childbearing age. So let's start a discussion about uterine fibroid and its homeopathic treatment. Okay, so what is uterine fibroid? As we were speaking, it is a non-cancerous growth, and its shape basically its size can vary from as little as a bean to even a large one. So in uterine fibroids, there are generally 4 types according to its location of the fibroid. One is intramural, which is located in the wall of the uterus. This is the most common type. The second is subserosal fibroid, located outside the wall of the uterus but underneath the tissue layer that surrounds the uterus. They can develop into pedunculated fibroid stalks and become quite large. The third one is submucosal fibroid, which is located in the muscle beneath the lining of the uterus wall. This type can protrude into the cavity of the uterus. And the last one is cervical fibroid, located on the neck of the womb, that is the cervix. Even if this is a differentiation, this is a division in fibroid according to the location of the fibroid. Next, as we were said in the previous video itself, that the whole menstruation process depends on the HPO axis, and any derangement in this axis causes hormonal imbalances, which can produce various kind of diseases. The cause of uterine fibroid. Now, this is the very important part. One of the major causes thought about uterine fibroid is genetics. Genetic mutation in few genes may cause uterine fibroid and make it an hereditary disease. And second, as I said, any problems in the HPO axis can produce any kind of diseases related to the menstrual cycle. So one of the another reasons is estrogen and progesterone imbalance. The third one is excessive stimulation of growth hormones. Whenever there is an excessive stimulation of growth hormones by the pituitary, it might produce fibroids. There are other causes also, which is related to nutrition, that is micronutrients such as iron that the body needs only in small amounts in the blood. For instance, a deficiency of vitamin D may be associated with uterine fibroid. Similarly, what we need, what was tried to made understand here, that sometimes even huge amount of micronutrients in our body might cause fibroids. Now, these are the general causes which you might find in most places. Even you can find it in the internet. What are the causes which are less talked about the reason for causation of uterine fibroid? Let's discuss about that. One of the very important causes, as I discussed earlier during my PCOD video, that psychological sphere, the mind of an individual is responsible for various kinds of any problem in the mind, any problem in emotions may cause a wide turbulence in the whole system of the individual. Similarly, stress, any sort of long lasting grief, any mental trauma, any depression, any suppressed insults, any anxiety might cause various kinds of problems in the female body. And this also corroborates as a cause of formation of fibroid as well. What we discuss less about is on this thing is that uterine fibroids, we are always saying that it might be genetic, it might be due to estrogen and progesterone imbalances. But why is there an imbalance in the estrogen and progesterone? What we need to understand is that when estrogen levels are high, fibroids tend to swell up, like in pregnancy. And again, when estrogen levels are low, down, fibroids have the tendency to shrink, like after menopause. From this, we can say that estrogen level has a direct effect on fibroids. Now, this estrogen level, if we think about it, is that estrogen is closely linked with a woman's emotional well-being. Depression and anxiety affect women in their estrogen producing year more than men or postmenopausal women. Estrogen is linked with mood disruptions that occur only in women, premenstrual syndrome, premenstrual dysphoric disorder, and postpartum depression. As I said, emotions have a high role in maintaining stasis in our body. Many of the health disorders in our life are psychosomatic. Similarly, uterine fibroid is also a kind of a psychosomatic disorder. It plays a big role in maintaining the hormonal balances in a female body especially, and many times it is seen that many female problems like amenorrhea, PCOS, etc. have a history of depression, anxiety, fright, or some kind of emotional trauma from which the problems have started. Now, the next we are going to discuss about is the signs and symptoms. As you can see, I found this image. As you can see, I found this image in the internet about stating about various kind of signs and symptoms. And what's the main complaint of the patient here is that there is a heavy menstrual bleeding. The menstrual period lasts more than a week, and sometimes it can even last for 10 to 15 days or even a month also. There is a pelvic pressure or pain, and in certain cases also it might also produce painful sex. That is, during coition, it might produce some sort of pain. It is generally present in a fibroid, which is a cervical kind of fibroid. Other symptoms which are very common during when a person has fibroid is frequent urination, difficulty in emptying bladder, constipation, backache, or leg pain. One of the things which I actually forgot to mention here, but I want to say, is that in most of the scenarios also, uterine fibroid tends to remain asymptomatic. Most of the times, very less number of individual patients even understand that they have a uterine fibroid. Many cases, it is an accidental finding during a routine sonography of the abdomen. So these are the symptoms. Whenever the patient is symptomatic, these kind of symptoms may appear. The other symptoms of these uterine fibroid is that due to this bleeding, it causes very much produces anemia and causes profound weakness in many of the patients, making them unable to even continue their normal work. These are in extreme scenarios which I have seen, and in these cases it also triggers a depression in many women, making the disease even worse. Complications. Now, the reason that many of the cases of uterine fibroid can also regress on their own, but what are the complications we need to know? See, whenever a female is in the reproductive years and they have got a uterine fibroid, one of the most biggest complications they might face is infertility. See, studies show that in most cases it is only submucosal fibroids which protrude into the uterus that may affect fertility. There are exceptions including large fibroids that block the openings of fallopian tubes into the uterus. most women who have fibroids will not face infertility as a result, but infertility is during even cases, when we get cases of infertility, at certain times we see that on sonography uterine fibroid is present there. Now, pregnant women with fibroids have a greater chance of placental abruption than women without fibroids. That is, what is placenta abruption? The thing is, during the pregnancy time, the placenta is placed in the uterus itself, and certain times there is a rupture in the placenta which causes even bleeding, that is threatening abortion at certain times, which is a major issue whenever a patient is having a fibroid. There are many problems in labor as well, and these kind of patients generally have repeated miscarriages in many a case. And the most uncommon symptom in these kind of cases is a swelling in the abdomen, generally on whatever side the fibroid is there. If the fibroid is too large in size, it might cause a little bit swelling in the abdomen, and it also causes an abdominal pain because it is occupying a place in the abdomen. Now, when we are thinking about the treatment of this uterine fibroid, why to think about homeopathy? See, in modern medicine, the treatment of choice is incising the tumor. Mostly laparoscopic surgery is prevalent in today's times, and certain times there is open surgery also. It is generally done in women of childbearing age, and those who already have kids and are not wanting anymore. That in those cases, and when there is a many number of fibroids present in the uterus, one of the most preferred method is a complete hysterectomy. That is, the whole uterus along with the fibroids, even with the ovaries, is removed. Now, whenever you are removing the uterus whenever you are removing the fibroids in laparoscopy, through laparoscopy or through incision and open surgery, the main thing which is the problem is that the root cause of all which is causing this fibroid is not removed. As a result, after even surgery and after even maybe laparoscopic or open surgery, there is many a times recurrence of this fibroid. And in the secondary times, the fibroid appears in another place, and there are even more chances of growing multiple fibroids when one fibroid is removed. And whenever there is a total hysterectomy done, because in many cases when there is too many fibroids, what happens is that the uterus in a female body is not only serving as a reproductive function, but estradiol, that is estrogen and progesterone, collaborate within bone remodeling on reabsorption of estrogen and formation of progesterone. Progesterone stimulates osteoblasts in vitro, menarche, that is before menarche. Progesterone stimulates the osteoblast cells, and after menarche, estrogen is the main responsible for which contributes to peak bone mineral density. That is, whenever the estrogen level is low, the bone density of the individual will start on decreasing. So, long story short, no uterus and no ovaries means no production of estrogen and progesterone, which through the process is decreasing the bone mineral density of a person. And again, this causes osteoporosis in the long term, that is weakness, the bones become weak in the patient. And in long term also, it produces arthritis and mostly osteoarthritis. So whenever the patient is going for a total hysterectomy, and even after hysterectomy, sometimes another point which I missed in this to write was that after total hysterectomy, there is a hormonal therapy which is given to many of the patients, and this hormonal therapy is even a very dangerous kind of treatment which is given to most of the patients, because hormones, whenever you are injecting into the body hormones which are basically foreign antigens, they tend to produce a reaction in the body, and then they also tend to produce other sorts of diseases in the body, including cancers as well. So this whenever you are removing this whole uterus along with the ovaries, you are doing more harm than curing the patient. So as a method of treatment, homeopathy is the best possible treatment of uterine fibroids, and homeopathy, as we all know, treats the patient and not the disease, and it is the most safest form of treatment. Now, coming to medicines in homeopathy, best possible treatment is constitutional treatment in homeopathic treatment. The best way to treat this kind of diseases is by constitutional treatment. Now, I've given some, as you can see, I've given some medicines, a list of medicines which is generally generally used by most of us in treating uterine fibroids. There might be many medicines, even more, which can help in treating this kind of cases, but I have pointed out few of them. I'll give a very short introduction of all these medicines which is generally used. I've ordered them in a way which I generally find them useful. According to the usefulness of the medicine, I have ordered them. Now, starting with the belladonna, we know belladonna is, as per discussion, belladonna is a very good medicine for uterine fibroid. Wherever there is a profuse early menses, which might be very much painful. Now, this painful menses vary from other medicines, as belladonna pains come suddenly and go suddenly. These comes in episodes. And definitely belladonna is indicated in tubercular patients, that is, they have a tendency to catch cold easily. And whenever we are talking about belladonna, we need to always understand its mind symptoms as well. And belladonna patients are generally very jolly in nature, and they tend to always smile whenever you are talking with them. Belladonna patients have a lot of fears. You can easily give belladonna on the basis of fear itself, because belladonna has got fear of darkness, fear of ghosts, fear of insects, fear of reptiles, fear of dogs, which is again a tubercular character. And similarly, we can prescribe belladonna easily in uterine fibroids who are indicating belladonna, because indication of belladonna is very much easier to find. Next medicine we can think of is calcarea carb, again a complementary and chronic of belladonna. We can think of calcarea group of medicines wherever the patient is a little bit overweight. Again, a tubercular diathesis is lurking in the background. What are the physical generalities through which we can easily find out if a patient is calcarea carb? Are few very easy points. That is, one is tendency to catch cold. Second is the perspiration, which is very marked. Calcarea group of people generally have got a tendency to perspiration over the scalp, over the neck area, and have got a little bit offensive sweat. Menstrual symptoms in calcarea group of patients is that menses are too early, too profuse, and too long lasting. And along with this, a very characteristic symptom, if we can find in these patients, that rather going for belladonna, we can think of calcarea carb, is that in calcarea group of patients or calcarea carb patients, we can get a painless hoarseness in the morning. And if not, this particular symptom might be present in all cases, but one of the symptoms which might be present is a painless dry cough, which is aggravated in the morning, and it is only a few bouts of cough in the morning, and after that it goes away. And this, if you can find along with the other characteristics of calcarea carb, you can definitely think of calcarea carb in this kind of uterine fibroid cases as well. Now, calcarea floor we can use in most cases of uterine fibroids if the patient is of calcarea belongs to the calcarea group of medicines, but the fibroid which is present in the uterus, it's of very hard, and it certain times can be palpated even over the abdomen, and you can find that those tumors are not soft in nature, but they are very hard in nature. In these kind of cases, these fibroids might even cause pain without even during the menstruation cycle. The next medicine we can think of is lachesis, which is an excellent remedy for uterine fibroids. And lachesis is generally indicated when these kind of complaints are appearing just before the menopausal time or during the menopausal time. If this kind of uh, symptoms are coming, you can think of lachesis. Except for that, also in young people, also in young girls, whenever you are thinking, you can think of lachesis. Whenever there are, you can find that there is jealousy present in those people, in those patients, especially wherever there is sibling jealousy is there. If you find sibling jealousy, that is the individual is a little bit has got a younger sister or a bigger sister whom she feels a little bit jealous of. You always know that jealousy is a very good indication of lachesis. Along with that, physically, you can always think that lachesis patients can't tolerate any tight clothing around their neck, can't tolerate tight clothing around their waist. Basically, they don't desire for loose clothing. Lachesis patients are generally hot patients. They will tend to be in a cool place. Another very important symptom of lachesis is that there is aggravation from sleep. Most of the patients, they have got an unrefreshing sleep, and their mood is worse in the morning. They are generally more energetic towards the evening and towards the night. In menstrual symptoms, a very peculiarity of lachesis is that in lachesis patients, menses are always at regular time. The blood is generally little bit darker color or little bit of clots, and it might be profuse at certain times. But one of the characteristic symptoms is that in lachesis patient is that the menses are generally on time. They maintain their regularity throughout the time, which is a very important symptom. Another very important symptom is that in lachesis as well as zincum metallicum, as we know, that all complaints, basically, if there might be little bit pain in the lower abdomen, pain in the back, pain in the thighs before menses, but all these complaints are generally ameliorated by the flow. This is a very important symptom of lachesis. Along with that, if you go in the mind, you can find different kind of symptoms. There is a religious melancholy. These patients generally tend to be very much religious in nature. And also, if you can go in the dreams, definitely you will find that there are certain characteristic symptoms that they have dreams that they are writing an exam, they can't write an exam, they are failing in it. They want to go somewhere but can't reach. There's dreams of accidents, dreams of being chased, dreams of being killed, dreams of violence. Very characteristic dreams of lachesis. There are a lot of characteristic dreams of lachesis on which you can even solely prescribe on their dreams. Next medicine we can think about is lycopodium, and lachesis is a left-sided remedy. So most of its complaints, other than the menstrual complaints, are going to be left-sided. Next, complementary to lachesis, again we can think of lycopodium after when you have already given lachesis and it has completed its work and it is no longer acting beneficially for the patient. In many cases, you can think of lycopodium, especially when the patient has become more towards chilly now from the hot patient. Now they have got along with this menstrual problem, one of the chief complaints they are having is GI problems. Basically, dyspepsia, distension of abdomen, which is ameliorated by either eructation or platters. Though in lycopodium we know it is much more relieved by passing platters. Again, in lycopodium kind of constitution, lycopodium patients, we know that it is again covering a tubercular background in its base. So these kind of people are again generally tends to have a tendency of catching cold, and with that they have got problems in digestion. So a few characteristics of lycopodium are that they are generally very both lachesis and lycopodium, they don't like being alone. They want company. Lachesis people are the main attraction in a group. they are the ones who are generally talking and they are conducting the conversation in a group. Lycopodium, similarly, differing a little bit from here, is that Lycopodium are generally a little bit afraid. They have got confidence. They are Lycopodium people are generally, what should I say? They are lions in their own home, but whenever they go outside, they uh, stop. They are very much afraid to speak up. Lycopodium people again have got very much religious side, and Lycopodium is again a chili patient, generally indicated in chili patients. The very characteristic physical generality of Lycopodium you can always think of is that Lycopodium patients may desire for sweet, may desire for extreme sweet actually. They may desire for salty, but one of the very characteristic is that they desire hot food. They can't tolerate cold food at all. This is a very characteristic symptom of Lycopodium. Now, moving to forwards, if we go towards Mercurius, it is a very interesting remedy in uterine fibroid. One of the main things you need to know in Mercurius is that instead of going for the directly for symptoms related to menses, it is very good to understand what are the accompanying symptoms of Mercurius. In Mercurius also, the bleeding is profuse and may last even for weeks, but along with there's a little bit of abdominal pains with the menses itself. The accompanying symptoms of Mercurius are very, very, very important, because in most cases you can just prescribe whenever these accompanying symptoms are carrying out with any kind of complaint. I'll try to clear up what are the accompanying symptoms. Here there is always some problem related into the mouth. There might be sensitive teeth, there might be gum bleeding, there might be pain in the gums, there might be excessive salivation, which is a very noted symptom of Mercurius. Individuals are generally wetting their pillow with saliva, that is, they are drooling during their sleep, which is a very good symptom of Mercurius. In gastric symptoms, we can think of Mercurius whenever there's mucoid stool associated with any of the complaints. Another very good physical general of Mercurius is their profuse sweat. They sweat profusely throughout their body, and sweating makes them feel more weaker than actually making them feel better. Mercurius patients have got are generally very sensitive to monsoon weather, and generally their tonsils are very much affected, so they have a definite tendency of repeated sore throat. In sore throat, as we can know, we generally tend to prescribe belladonna and Mercurius as a very common prescription. So Mercurius has a very tendency to of tonsillitis. So along with the symptoms of menses, if we can find out constitutionally that the person belongs to Mercurius group, then we can easily prescribe and have lots of success. Next medicine we can think of in this kind of uterine fibroid is pulsatilla. Now, pulsatilla, the menstrual symptoms are the menses are never on time. First, second thing, they can last long, they can even be very short, and they might be very much profuse in nature. Then most of the complaints are starting from the menarche itself, and also pulsatilla patients, the very good indications for pulsatilla patients is that whenever you are in the personality of pulsatilla, they can weep very easily. They, small matters, whenever they are even scolded in small matters, they tend to weep easily. Whenever they are hurt even a little bit less, even while thinking of what has been done to them, they can weep easily. A very characteristic symptom of pulsatilla is thirstlessness though, but in chronic cases of pulsatilla, I have seen myself that many pulsatilla patients are thirsty in nature. A very good indication of pulsatilla is the intolerance to fried food. They do desire fried food, but they are generally intolerant towards it. In bowel movements also, pulsatilla patients tend to go to the washroom at least 3 to 4 times a day, but it is normal for them. It is not like Nux vomica that they have an unfinished sensation. talking about nux vomica, I forgot to mention say about nux vomica. Now, nux vomica patients, again, in the menstrual complaints, menses might be too early or too long lasting, and even very much irregular. Now, nux vomica patients, what are the best things to note about nux vomica patients is that they are very much hypochondriac in nature. That is, even if they feel less amount of pain or less amount of complaints, when they are going to describe it to you, they are going to exaggerate it in a very high manner, so that you, in order to get your attention more and more. In any nux vomica patient, what is common is their irritability. They are easily irritable, and they can get irritated very easily, and they are very good in finding faults. No matter wherever they are very much attentive to details, but they find faults easily. Nux vomica patients, what are the main cause of the whole of their irritability is their gastric problems. See, in nux vomica patients, the most characteristic symptom in nux vomica patient is that unsatisfactory stool. That is an recurrent urging for stool, but it is not satisfied. This causes a very big irritation in the whole individual of nux vomica. And this unfinished sensation is not only in the bowel movement, in urination also. There is increased number of frequency of urine, which accompanied by an unfinished sensation during urination. So, in any case, no matter what may be the pathology, if you find this kind of unfinished sensation in stool or in urine, along with irritation, who is generally a chilly patient or may desire covering during sleep, you can easily think of nux vomica. No matter whatever be the complaint, you can easily prescribe nux vomica. Now, then moving on to next medicine, Thuja is one of my favorite medicines. I would definitely say so. The Thuja is a very versatile drug which can be used in so many pathologies, with so much success. Thuja patients also, we need to just think if we can find the Thuja constitutionally in any patient, no matter what may be the pathology, we can easily prescribe Thuja, and it is going to give a lot of relief to the patient. What we can think of in Thuja is that there might be very few good points, is that they are stuck in their thoughts. One of the main things of Thuja is fixed ideas. It's now you have read about fixed ideas in Thuja, that is of different kind. One of the main fixed ideas we need to understand about Thuja is that whenever there is a thought going around in their mind, they can't get rid of it. They just go on and on and on and on in their head. Secondly, whenever thinking of Thuja, in mental general, they are very much planned. They always plan things before actually making them possible. They are like arsenic. They are a little bit perfectionist. They like their things to be arranged, but they are very slow in working. In physical generals also, the main characteristics which makes me go for Thuja is that they can't tolerate sun exposure, just like natrum group of medicines. They in bowel movement, they have a habit of passing their bowels after only taking a little bit of water or tea or having breakfast. They never tend to go before that, and this is the morning time itself they generally prefer going. They in perspiration, Thuja, generally there is a perspiration in the forehead, which is a very characteristic of Thuja. Along with an oily face, you can always think of Thuja. These are very common symptoms. If you can find in many patients, you will actually find. And since uterine fibroid is a psychotic growth, basically psychotic miasm is coming into play. So Thuja is a very good medicine for that. When we go to think of medullarinum, we can always think that with this growth, there is some sort of burning present, because medullarinum, whenever you are thinking, you need to think of two things. One is burning, and then there is restlessness. That is, burning is always there with a very increased amount of thirst. Medullarinum patients even always wants to have water, even during their sleeping time. They will wake up feeling thirsty. Along with that, they have a desire for rainy weather. They in mind the main best symptom to go for medullarium is for their forgetfulness. It is unlike anacardium, but it is they generally tend to forget what they are doing. They generally tend to forget where they have kept things. They generally tend to forget names of people whom they know for quite a long time, but they can't remember their names. Medullarium, again, you can think of medullarium where the person forgets routes, where forgets roads, known roads. He forgets how to go to a destination he can't go. These are very simple indications of medullarium which I use. Generally, there are indications of thuja along with the burning and along with the increased thirst. I generally go for medullarium. This is a very simply I prescribe medullarium in my clinic. Next medicine we can think of is ignatia, which is a very important remedy considering what we discussed earlier, how emotions play a very large role in producing and maintaining this kind of fibroid. So in ignatia, whenever we are thinking, the main your concern should be the causation of the disease. If you find that before this development of fibroids or development of all these symptoms, the person had gone a very deep emotional trauma or had a very bad had suffered from a grief, extreme grief, or has been going through a lot of depression, you can think of ignatia. Generally, you will find these patients to be of natrum group, natrum mure constitution, but before even giving natrum mure, you need to think of thuja. Another very interesting medicines we can think of in uterine fibroid is definitely Aureum natronatum. It is one of the best medicines for uterine fibroid, but it is always being empirically used rather than being used as a constitutional medicine. It is a very simple medicine. If you find natrum mure constitution in a patient, along with added symptoms or Aureum group of patients, you can think of Aureum nat. I will later on discuss a case of Aureum nat which I got. I'll definitely tell you more about it. Natrum mure, again similar, there might be a history of grief in physical constitution, but the patient is more energetic while in empty stomach. There is increased desire for salt. If you don't find that, there might be increased desire for bitter things, which is a very marked indication for natrum group of medicine. It's not only just if we find natrum group that we will have to prescribe natrum mure, but we can also prescribe natrum salve or natrum art in this kind of places wherever the dominance goes. Natrum mure patients generally can't tolerate sun exposure, and they have increased amount of sweat in their upper lip, forehead, and moreover the face. If you find this kind of symptoms in a patient who is having a past history of mental trauma, who is a little bit brooding in nature, who wants to remain alone, whose anger is who is generally very angry very easily, and where there is a consolation aggravation, and who can't tolerate tobacco smoke or any forms of smoke, you can think of natrum. Now, the next medicine is Fraxinus americana, and I will end with here itself. Phosphorus, Platina, Silesia are very good medicines in uterine fibroid as well. But I personally, from my perspective, I have used these medicines very less. Fraxinus americana is generally used in mother tincture form, and it is almost very much specific for uterine fibroid, just like Aureum nat, which is prescribed in decimal scale. So next, while discussing, we need to understand that what are the problems during the treatment which comes up. It is not at all uncommon to face some problems even while giving constitutional medicines to the patient, because there might be excessive bleeding during menses lasting for more than 4 to 5 days to even 10 to 15 days or even a month, which causes severe blood loss and in turn producing signs of anemia. In this kind of cases, we need to manage this bleeding with these medicines which I have listed in this slide, which is always helpful in controlling menstrual bleeding. A very good medicine is Thalassotropes pastoris, especially whenever there's bleeding profuse in 1 month, followed by less amount of bleeding in the second month, again followed by profuse bleeding. In this kind of cases, we can think of thalassemia versa. Another very good medicine is psyllium pendulum, where there is bleeding very easily, very profusely, and along with a very pain in the hips, as if the hips would go away. Next medicine we can think of C. calicor, which is a very good medicine for again hemorrhage. Ficus religiosa, when there is excessive hemorrhage of bright red color, we can think of Ficus religiosa. And acid gallic is 6 or 30 potency. We can think when all of the other medicines are not working. This is a very beautiful remedy which controls bleeding almost very immediately after its administration. Now, this was all medicines I could think of in uterine fibroid. But I would like to discuss a case which is not most of you till now might have seen cases of uterine fibroid, and it is moderately easy to even treat for many, and you might have got much success in uterine fibroid also. So today I'm not going to be discussing a case where I got success, but it is a case where I actually failed to see the complete picture of a patient, and it took me a long time to treat this case. It was a 23-year-old married girl who came to me for treatment with USG report suggestive of uterine fibroid and PCOD. She was very cheerful disposition, constantly laughing during our conversation, and she complained of heavy bleeding and painful menses. This was during my internship time at NIH, and this patient came to me during that time. And on a full case taking, on the first visit, I started with pulsatilla. First, I gave her LM2, then followed with LM3. On subsequent follow-ups, I continued pulsatilla for some time, and after that, I switched to many other remedies like belladonna, puja. But after a certain amount of time, I actually, when most of these cases, like it had gone almost 1 year, the PCOD, the ovarian cysts were gone, but the fibroid remained almost same in size. And I have been giving her Fraxinus americana side by side, but it was of no use. So on a further case taking, when I tried to unveil her mental symptoms, I came to understand that there was a lot of problems going in her family life, especially with her spouse, and which was making her more and more depressed towards life. So based on that basis, I started with Ignatia and then followed with Natramur. But also in this case also, there was no reduction of the fibroid even after 2 to 3 months or 4 months of treatment. In this time, when I was almost feeling that the patient described a very interesting symptom to me, that whenever she was whenever she wanted whenever she was very much depressed or felt like crying, or whenever she was hurt, she used to hurt her own self. She used to throw a brick at her own toes, just think on it, and that pain would make her emotional pains go away. This self-injury, on further questioning, I understood that she had a desire for darkness, just like Aurum group of medicine, and somewhere within she had wanted she had this suicidal impulses as well. So on this basis, when I got all this kind of symptoms, I prescribed her Aurum Nat, but in LM potency, not in decimal scale. And within a few months, like 2 months itself, in LM potency, her fibroid was totally gone. So this, in this case, what I wanted to actually tell you is that through this case, I actually wanted to tell you guys that in cases, since it was just I started my practice just at that time, what I wanted to say that you need to always take a very good mental picture whenever you are considering any kind of pathologies related to female reproductive system, because emotions play a very active role in these kind of cases, and no matter whatever your prescription is, it should have a basis on the mind as well. So this was all what I could say about uterine fibroid. Hope this helps in your practice, and I hope you have a very good day.